Imagine your skin is like a fortress, meant to protect you from outside invaders. But when eczema breaks down its walls, it opens doors for viruses, bacteria, and fungi to invade, causing irritation, infection, and discomfort. For millions dealing with eczema, this isn't just a minor annoyance, it's a daily battle against itchiness, inflammation, and the constant risk of infection. But did you know that these infections can lead to serious complications if not treated right away? Let's dive in and uncover how to identify, treat, and prevent infected eczema, so you can protect your skin and your health. What is infected eczema? Eczema is already a challenging condition, with red, itchy patches that flare up seemingly out of nowhere. But when bacteria or viruses find their way into cracked or open skin caused by eczema, that's when infection strikes. And it's not uncommon. In fact, anyone with eczema, especially infants and children, can experience infected eczema. Why is this important? Eczema infections make the condition much worse. Besides worsening the appearance and the symptoms, infections can lead to complications like increased blistering, scarring, and even life-threatening conditions like sepsis or blindness in rare cases. Let's break down what causes these infections, so you can see why treatment and prevention are critical. The culprits behind infected eczema. 1. Bacteria. Staphylococcus aureus, S. aureus. Most of us have this bacteria living on our skin without issue, but for those with eczema, S. aureus can enter through broken skin and cause serious problems. Staph infections make healing eczema much harder. 2. Fungi. Candida albicans, C. albicans. Candida is a yeast that can infect eczema patches, particularly in warm, moist areas like the diaper region in infants. This can worsen eczema symptoms and cause discomfort. 3. Viruses. Herpes simplex virus, HSV. When HSV infects eczema, it leads to a condition called eczema herpeticum, which can be severe and even dangerous. Eczema herpeticum is more than just a simple infection, it can spread rapidly and, without treatment, can lead to serious health complications. Signs and symptoms of infected eczema. How can you tell if eczema is infected? Here are the telltale signs to watch for. Swelling, discoloration, and tenderness. If an eczema patch becomes redder, puffier, or tender to the touch, it could indicate infection. Burning and severe itching, even more intense than regular eczema itching, an infected area may burn and cause severe irritation. Fluid drainage and pus, open sores can ooze white or yellow pus, a sign that bacteria have likely set in. Blistering and crusting, blisters may form and burst, leaving behind a crusty layer. This is common with bacterial infections and should be treated quickly. More severe symptoms, fever, chills, and fatigue signal a more serious infection. If eczema becomes infected, immediate medical care can be essential to prevent complications. The risks of leaving infected eczema untreated. Ignoring infected eczema can have dangerous outcomes. Here's what might happen. Prolonged eczema flare. Infection makes it harder for eczema to heal, meaning you might suffer longer and more intensely. Scarring and discoloration. Open sores that scab over can leave behind scars or dark patches that last even after the infection clears. Sepsis. In extreme cases, untreated staph infections can lead to sepsis, a severe, potentially life-threatening infection that spreads throughout the body. Eczema herpeticum complications. If HSV spreads through eczema, it can infect organs like the liver, brain, or lungs, causing major health risks, including blindness if it reaches the cornea. Treatment options for infected eczema. Your treatment plan will depend on what's causing the infection, whether it's bacterial, fungal, or viral. 1. For bacterial infections. Doctors often prescribe antibiotics, either topical or oral. To reduce swelling, a steroid cream might also be recommended to ease symptoms. 2. For fungal infections. Antifungal creams, or oral medications can tackle yeast infections, especially for rashes and moist areas. An over-the-counter antifungal cream might even do the trick, but check with a doctor before starting any treatment. 3. For viral infections. Eczema herpeticum from HSV infection demands antiviral medications like valacyclovir, Valtrex. This type of infection requires fast treatment due to its potential severity. 4. Natural alternatives, with caution. Essential oils, tea tree oil or evening primrose oil have properties that may help reduce irritation, but these should be secondary to prescribed treatment. Oatmeal baths, soothing and natural, oatmeal baths can relieve itching and help dry out sores. Herbal supplements, there are herbal options that some find helpful for eczema flares. Still, it's best to consult a healthcare professional before trying any new remedy, natural or otherwise. Prevention tips, protecting your skin from infected eczema. Preventing infection is key. Here's how you can fortify your skin. 1. Daily emollient application, keeping skin hydrated with a moisturizing emollient strengthens its barrier. Avoid products with harsh chemicals, opt for gentle, hypoallergenic formulas. 2. Practice good hygiene, use a clean tool to scoop creams out of jars, not your fingers. This minimizes bacteria entering the container and prevents infection. 3. Protect skin from triggers, identify and avoid common irritants like dust, certain foods, or rough fabrics that can worsen eczema flares and break down your skin barrier. 4. Stay vigilant with kids. Children are more prone to scratching, so monitor their skin for open sores and keep them from scratching. Q&A, common questions about infected eczema. Q. How can I spot an eczema infection early? Look for signs of inflammation, oozing, severe itching, and pus. The earlier you catch these signs, the better the treatment outcome. Q. What are common eczema triggers I should avoid? Dust, certain foods, like eggs and nuts, and even some fabrics like wool can trigger flares. Knowing your triggers helps prevent breaks in your skin's barrier. Q. Will infected eczema go away on its own? It's possible, but treating an infection as soon as you notice symptoms is always best. Infections that linger can become serious, so see a doctor for a faster, safer recovery. Final thoughts, a path to healthier skin. Infected eczema can be painful, frustrating, and even risky if left untreated. But by recognizing the signs early and understanding how to prevent infection, you can take control. Protect your skin by avoiding scratching, staying moisturized, and consulting a doctor at the first sign of infection. Remember, the faster you act, the quicker you can get back to feeling good in your skin. So keep your skin barrier strong, practice good hygiene, and treat flares as they arise, because your health deserves nothing less. Thank you for watching. Be sure to like, subscribe, and hit that notification bell so you don't miss our next video on skincare and health tips. Stay safe, stay healthy, and keep protecting that fortress of yours.